So let's talk a bit about self-care for care partners. I think this can obviously be a really taxing time. Why is self-compassion essential during this time when you're caring for someone else?
Because many times, again, the focus is on the patient, but we need to recognize it's stressful for all of us. And the whole medical team is taking care of the patient. Very few people are paying attention to the caregiver. So they really need to be able to ask for help. Hopefully, again, it's not a one-man job and rally the village around the person. We do ask for those first few weeks that it's 24 hours a day, the patient be with someone, but it doesn't have to be one person. So have someone else come in so you can go exercise or go get a cup of coffee or just spend time, dedicated to self-care so that then you can be as strong and as present as you can for the patient.
And what are signs of burnout? How can care partners recognize that?
Very hard to recognize, and usually it's someone else who needs to point it out. But emotional exhaustion, I think, is the most common because it is such an emotionally taxing time. So having a difficult time concentrating, being irritable or pessimistic when sometimes the medical team's like, everything's going great. And still you're like, no, but it's not going to last, or putting a negative twist is usually part of that. You just don't have the reserves to look forward. And then changes in sleeping or eating or regular habits can also be a flag.
And what advice do you have for care partners to make time for self-care? When can they find those spaces for themselves?
I think the biggest thing is to not think that it's being selfish or that you're taking away from the partner. Think of it as something you are doing for the patient. You are not useful if you're burnt out and if you're spent. So self-care really is a giving activity of art in strengthening yourself so that you can then be of most use to the patient.
How can a care partner manage the emotional aspects when a loved one is going through CAR T?
I think be patient, recognize that it's a really difficult time, even when everything goes according to plan and everything is, the medical team is very pleased that there's nothing untoward. It's just a really stressful time for both of you. So it's where we go back to the self-compassion as well, is take time for yourself and recognize your needs as a caregiver in addition. So tapping in again, other friends, a small circle rather than a one-person job, and being really open with social work on what resources can be helpful. Like asking for help, again, is a brave act. It's not a sign of weakness at all.
Sure. And I think it's often that people will offer help and you tend to decline because you can think you can handle it early on. And it is just so much easier to say yes than say, yes, bring over dinner, or yes, I'd love you to come over for 2 hours while I go out and have a pedicure. So yeah, always say yes to when people ask you if they can help because people want to help.
Exactly. And it is that group activity and it's a shared experience.